Hello everyone, welcome to today's lesson. I hope you are doing well. In this video, we will learning about arterial supply of head and neck. By the end of this lesson, you will have clear understanding of key concept. Arterial supply of head and neck in very simplified version. Okay, let's begin with this. Okay, firstly, we'll learn about some basic concept. Firstly, learn about arc of aorta. Arc of aorta is present at the level of T3 and T4 vertebral level. Okay, T3 and T4 vertebral level. T3 and T4 vertebral level. Okay, this arc of aorta. This is arch of aorta. After which it is subdivided into right side and left side. This is right side, this is left side. Okay, after which on the left side there is a direct branch from the arc of aorta. What is first arc of aorta? Left common carotid artery and left subclavian artery is two branches of arc of aorta on the left side, whereas on right side there is a direct branch, is single branch, that is brachiocephalic trunk is arise from arc of aorta. Okay, that is right brachiocephalic trunk, which further subdivided into the right common carotid artery and right subclavian artery. Clear? This is the left side, left subclavian artery and left common carotid artery, and in the right side there is a right brachiocephalic trunk, and then further divided into the right common carotid artery and right subclavian artery. Clear? Easy? So mainly common carotid artery is a chief artery supplying head and neck. Okay, further divided into right and left. राइट कॉमन कैरोटिड आर्टरी ब्रेकियोसेफेलिक ट्रंक से अराइज होगी कहाँ पे? लेवल ऑफ बिहाइंड द राइट स्टर्नोक्लेविकल जॉइंट ऑफ द नेक at the level of C3 and C4 vertebra. Clear? The right common carotid artery arises from brachiocephalic trunk and the left common carotid artery arises from arc of aorta. Okay, these common carotid arteries further subdivided into internal carotid artery and external carotid artery. Further subdivided into internal and external carotid artery at the level of C3 and C4 vertebra. Okay, clear? First is the arc of aorta, which further subdivided into right and left. On left side, this is directly branch of arc of aorta is left common carotid artery and left subclavian artery, and on the right side there is a right brachiocephalic trunk, which further subdivided into right common carotid artery and right subclavian artery. This common carotid artery, both sides right and left, has common pathway now on right and left side, which further subdivided into internal and external carotid artery at the level of C3 and C4 vertebral level. Intervertebral disc between C3 and C4 vertebra, divided into terminal branch, external and internal carotid artery. So in this video we mainly talk about external carotid artery and its branches. Okay, in the further next video we simplified version internal carotid artery we will study. So let's begin with it. Firstly, some thing about carotid sinus and carotid body. Carotid sinus is the dilation at the terminal end of common carotid artery or at the beginning of internal carotid artery. Just at the beginning of internal carotid artery there is a dilation which is known as carotid sinus. It has rich innervation from glossopharyngeal nerve. Okay? It acts as a baroreceptor, pressure receptor, regulate blood pressure. If blood pressure increase or decrease at this carotid sinus present at internal carotid artery beginning, it becomes stimulated and sended signals to glossopharyngeal nerve and then regulate the blood pressure. Okay? So that's why it's called baroreceptor. Okay, baroreceptor. Next is the carotid body. Carotid body is small oval structure situated just behind the bifurcation of common carotid. जब common carotid आ रही है और वो bifurcate हो रही है, वहीं पे एक small oval structure present है यहाँ पे. Okay? Small oval structure behind the bifurcation of common carotid artery. It is act as a chemoreceptor. Mainly chemoreceptor. It's respond to the changes. कब respond करता है? Respond to the changes to the oxygen and carbon dioxide content of the blood. Okay, these part mainly cover in physiology, how it is react, how it increase or decrease the blood pressure. Mainly main motive here is to location of the carotid sinus and carotid body. Carotid sinus is dilation at the beginning of internal carotid artery, and carotid body is a small oval structure at the bifurcation of common carotid artery. Carotid sinus is baroreceptor and carotid body is chemoreceptor. So let's begin with the external carotid artery. External carotid artery and its branches. Firstly, anterior branches. Anteriorly, it gives three branches: superior thyroid artery, lingual artery and facial artery. Superior thyroid artery to the thyroid gland, larynx. Okay, superior thyroid artery to the larynx, thyroid gland. Okay, superior thyroid arteries arise from the anterior aspect of superior thyroid artery, anterior aspect of external carotid artery, just below the tip of greater corner of hyoid bone. Okay, just below the tip के नीचे hyoid bone जो होती है, hyoid bone ठीक है, hyoid bone की टिप, ग्रेटर कॉर्नर ऑफ hyoid of bone की टिप के नीचे से अराइज होएगी and run downward, forward, parallel and superficial to the external laryngeal nerve to reach the upper pole of thyroid gland. So mainly it supplies the thyroid gland, and nerve accompanying with it is external laryngeal nerve. Okay, when you learn about thyroid gland, you generally know about how it come and during surgery ligation, how it ligated. As there is a relationship of superior thyroid artery to external laryngeal nerve, so therefore during the thyroidectomy, to avoid injury to the nerve, the artery should be ligated to near or to the gland as possible. This will study in detail about it in the surgery part. Okay, during thyroidectomy. Okay, main motive is only you remember it: superior thyroid artery supply the thyroid gland and larynx, and accompanying nerve with it is external laryngeal nerve. Okay, superior thyroid branch is further branches is infrahyoid branch, infrahyoid sternocleidomastoid branch, superior laryngeal branch and glandular branch. Okay, four branches are there: infrahyoid, sternocleidomastoid or superior laryngeal artery, and fourth one is the glandular branch, which is not mentioned here. You can write it down. Okay, next is the lingual artery. Lingual artery supply to the oral floor and tongue. Lingual artery, as name suggests, it arises at the tip of the greater corner of hyoid bone. Superior thyroid at below the tip of greater corner of hyoid bone, or lingual artery at the tip of the greater corner of hyoid bone. Clear? Facial artery. Facial arteries arise just above the tip of the greater corner of hyoid bone. ठीक है? Facial arteries pathways. Firstly, Firstly, remember their names. Okay. Then in detail. Okay. Anterior branches are three: superior thyroid artery, lingual artery and facial artery, which is arise near the hyoid bone, greater corner of hyoid bone. Okay. It is below the tip of hyoid bone, greater corner of hyoid. It is at the tip of greater corner of hyoid bone, and facial artery is above the tip of greater corner of hyoid bone. Clear? Next is the medial branch. Medial branch कौन सी है? One and only branch is ascending pharyngeal artery to plexus of skull base. Clear? Next is a posterior branch. Posterior branch is only two: occipital artery and posterior auricular artery. Occipital to the occiput, or posterior auricular artery to ear. Clear? Next is the terminal branches. Terminal branches is superficial temporal artery and maxillary artery. Clear? Superficial temporal artery to temporal region, and maxillary artery is the largest terminal branch. Maxillary artery is very important. Its branches name is very important. Facial artery and maxillary artery is very important for your exam point of view and also in the NEET MD's point of view. Okay, so let's begin in detail. Lingual artery rise at the tip. Okay, so first it has three part. First part is lie in the carotid triangle. First part in line lie in the carotid triangle and form characteristic loop with its convexity directed upward. Second part lie deep to hypoglossal muscle, and third part run upward along the anterior border of hypoglossals and forward on the under surface of the tongue, where it anastomose with its fellow opposite side. थ्री पार्ट होते हैं इसके. फर्स्ट पार्ट जो है कि कैरोटिड ट्रायंगल में होगा, जो कि लूप बनाएगा कन्वेक्सिटी डायरेक्टेड अपवर्ड रीचिंग अबव द ग्रेटर कॉर्न ऑफ हाइड बोन. तो कैरोटिड पार्ट ट्रायंगल में जो होगा वो फर्स्ट पार्ट होएगा. एंड देन सेकंड पार्ट जो है हाइग्लोसल डीप टू दी हाइग्लोसल मसल. एंड थर्ड पार्ट जो है वो एंटीरियर बॉर्डर, मतलब वो उसके सुपरफिशियल आ जाएगा. तो यहाँ पे आ जाएगा वो किसकी अपवर्ड एंटीरियर बॉर्डर ऑफ हाइग्लोसल मसल. ठीक है, फिर किसके अंदर चला जाएगा डीप सरफेस ऑफ टंग. टंग को सप्लाई करती है ना मेनली ओरल फ्लोर एंड टंग. दिस इज द लिंगुअल आर्टरी. नेक्स्ट इज द फेशियल आर्टरी. फेशियल आर्टरी इज डिवाइडेड इनटू टू, cervical part and the facial part. Okay, first I open the image of facial artery so that you remember easily. This is the facial artery. We have cervical part and the cranial part. So cervical part in the neck. Cervical part neck, it has four branches. Ascending palatine artery. This is the facial artery. 1 minute. This is the external carotid artery, and from this facial artery arises, from which in cervical region, cervical yani neck, in the neck first ascending palatine artery arises, which arise near the origin of facial artery. ठीक है, accompany the levator palatine and supply किसको करती है, ascending palatine है, palate को ही करेगी, तो ascending palatine supply the palate. Next branch is the tonsillar artery, main artery of tonsil. ठीक है, pierce the superior constrictor muscle and end in the tonsil. Okay, next is the glandular branches. This is the glandular branches. This is the glandular mark किया हुआ है. Glandular branches, 3 glandular supply the submandibular gland. Clear? Next, submandibular gland and then submental artery. Submental artery, large artery which run forward to the mylohyoid muscle along with mylohyoid nerve. Okay, and supply the mylohyoid muscle, submandibular gland and sublingual salivary gland. ठीक है, ग्लैंडुलर यहीं से, जहाँ पे ग्लैंडुलर ब्रांचेज हैं यहीं से को सबमेंटल आर्टरी जाती है अलॉन्ग विद माइलोहाइड नर्व, माइलोहाइड मसल्स के अंदर फॉरवर्ड करती है and supply the mylohyoid muscle, mandibular and sublingual salivary gland. Clear? Next, in facial part begin at the anterior inferior angle of masseter. This is the masseter muscle. Anteriorly and inferiorly it arise facial part. ठीक है, this is the cervical part from which the 4 branches arise: ascending palatine, tonsillar, glandular and submental. Clear? Ascending palatine, tonsillar, glandular and submental. Okay, after which facial part begins at anterior inferior angle of masseter, then run upward in tortuous way, run upward and forward to reach a point half inch lateral to the angle of mouth. Angle of mouth है ये, this is the angle of mouth. इसके एंगल ऑफ माउथ के क्या है, हाफ इंच लेटरल टू हाफ एंगल ऑफ माउथ हो जाए. देन इन सेट टू बाय द साइड ऑफ नोज़ की तरफ जाएगी, नोज़ के साइड में, एंड मीडियल अप टू द मीडियल एंगल ऑफ आई, एंगल के मीडियली एंगल ऑफ आई तक पहुँच जाएगी. वेयर इट टर्मिनेट बाय सप्लाइंग द लैक्राइमल सैक एंड एस्मोसिस विद डोर्सल नेजल आर्टरी, डोर्सल नेजल ब्रांच ऑफ ऑप्थेल्मिक आर्टरी. Clear? It has two part, cervical part and facial part. cervical part जो है ascend deep to the digestic muscle पे, deep to the digestic and styloid muscle. As mentioned in the diagram, digestic muscle and styloid muscle, deep to this digestic and styloid muscle के क्या जाएगा, first part cervical part जाएगा. देन passes deep to the ramus of the mandible. ये ramus है mandible का, दिस इज़ द ramus of mandible के डीप ही जाएगी. देखो हमको ब्लर दिखा रखे ना, पॉइंट यानी कि उसके डीप है. ramus of mandible where it grooves the posterior border of submandibular, posterior border of submandibular gland के posterior border पे जाएंगे के make a S shape band and first widening downward and forward over the submandibular gland, posing up over the base of mandible. ठीक है. देन देयर इज अ ब्रांचेस क्या होंगी, ब्रांचेस ऑफ सर्वाइकल पार्ट इज ascending palatine artery, supply the palate, tonsillar artery, tonsil, and glandular branch to glands, mainly the submandibular gland, and submental artery supply the mylohyoid muscle, submandibular and sublingual gland. Then the facial part rise at the anterior inferior angle of the masseter muscle and then run upward lateral to the angle of mouth and give the branches inferior labial artery and superior labial artery, which supply the lower lip and the upper lip. Then lateral nasal artery branch of facial part, which supply the ala and dorsum of nose, and then terminate as angular artery at the medial angle of eye, where it run up to medial palpebral ligament of eye and osmose with the branches of ophthalmic arch, dorsal nasal branch. ठीक है, डोर्सल नेजल ब्रांच के साथ एनस्मोज कर जाएगी, जो इसकी ब्रांच है ऑप्थेल्मिक आर्टरी की. दिस इज अ फेशियल आर्टरी, वेरी इंपॉर्टेंट आर्टरी. क्लियर? नेक्स्ट we have covered about the facial part, facial artery, cervical and facial. Cervical ascending palatine artery supply palate, tonsillar artery, submental and glandular branches. Facial part में क्या है, facial part में inferior labial artery, superior labial artery, lateral nasal and terminate as angular artery. Then medial is the ascending pharyngeal, branch is the ascending pharyngeal artery, which supply to the plexus of skull base. Clear? Then occipital artery arise from the posterior part of external carotid artery. ठीक है. Occipital artery crosses the apex of posterior triangle of neck. Then posterior auricular artery crosses superficial to the styloid muscle. ठीक है, styloid muscle के पास superficial to styloid muscle, where is facial artery deep to styloid muscle. Okay, so remember it. And posterior can be accidentally cut by incision given surgery on mastoidentrum. We do surgery near mastoidentrum, can be accidentally cut. So posterior artery, auricular artery is present superficial to styloid muscle, so take care during the surgery of mastoident. Then the terminal branch is superficial temporal artery. Superficial temporal artery supply to the temporal region, ear. ठीक है, it has two branches which supply the temple and scalp. First is the transverse cervical. 1 minute. Transverse cervical. Transverse cervical artery branch is the branch of superficial temporal artery. Second branch is the middle meningeal artery. The pulsation of superficial temporal artery can be felt in front of tragus of ear. ठीक है, superficial temporal artery की अगर हमें pulsation लेनी है is front of tragus of ear. Clear? Maxillary artery is the main terminal branch of the external carotid artery. So I think we talk about maxillary artery in detail, their branches in the next video. I think this is enough for the day. All of you are remember now by the name. Okay, we learn about the arc of aorta, division into the brachiocephalic trunk right side, and the left side is left common carotid artery and left subclavian artery. The right brachiocephalic trunk subdivided into subclavian artery and common carotid further subdivided into internal carotid artery and external carotid artery. And external carotid arteries have different branches: anterior branches, inferior thyroid artery, lingual artery, facial artery. Medial branch is the ascending pharyngeal artery, posterior is the occipital and the posterior auricular artery, and terminal superficial temporal and maxillary artery. All of this we are covered. External carotid artery, only remaining is the maxillary artery branches. It is important topic and its branches many time asked, so we cover in next video, okay, with the simplified manner and in mnemonic way, so that you can remember it. Okay, if you have any doubt you can ask me anytime. Okay, thank you everyone, hope you like it. Do like, share, subscribe this video. Thank you everyone.